Okay, we're going to go ahead and get started. Welcome again to Let's Talk About Alternative Methodologies, discussion number 5, cost-informed decision-making and budgeting. Last month, we discussed how to analyze cost data, and today we'll focus on how to make funding and budgeting decisions based on cost data. And whether you've attended the Let's Talk webinars in the past, or this is your first Let's Talk webinar, we welcome all of you. Before we get started, I just want to mention that this webinar will be recorded. And I'm excited to introduce the group of presenters today. We have a wonderful group. Dr. Ruth Friedman, Director of the Office of Child Care, is joining us, along with Leela Wendell, Assistant Director of the Division of Child Care in Arizona's Department of Economic Security. Hannah Matthews, Director of Policy Planning and Research at the Division of Early Learning in the Office of the State Superintendent of Education in Washington, D.C. Lisa Brochard with the National Center on Early Childhood Quality Assurance, and Sharon Oakes with the National Center on Subsidy Innovation and Accountability. And I'm Nina Johnson with the National Center on Early Childhood Quality Assurance. And we'd also like to have a sense of who you are. So please take just a moment to respond to the poll and let us know. And just keep in mind that the results of this poll will not be broadcast. Okay, looks like most of you have responded. So we'll go ahead and move on. So after the opening, Dr. Ruth Friedman will share some remarks on behalf of the Office of Child Care. And then Lisa Brochard will engage you all in a discussion about your North Stars and your current fiscal context. And then the remainder of the discussion will focus on identifying provider and system level gaps and exploring funding mechanisms and strategies. Lisa and Sharon will guide us through those discussions, and we'll also get to hear from Leela and Hannah. So we hope that when the webinar ends, you'll have learned how other lead agencies make funding decisions based on their cost studies and budgets, and that you'll have learned about strategies to address the gap between the market rate and the true cost of care. So we're going to take just a minute now to check in with one another. So if you could please share in the chat, what is your favorite thing about fall? Cool weather and pumpkin. Nice. Pumpkin spice latte, pumpkin flavor, fall flavor, or actual pumpkins? Chili and soup season. I totally hear you on that. I think we're going to make chili tonight. The weather, the colors, sweet potato pie. That sounds delicious. The colors and scents of the season. My favorite thing, or Leela's favorite thing about fall in Arizona is the state fair. That sounds like fun. I totally forgot about the state fair being in the fall. And all the good food that comes with it. The changing of the colors and the leaves, the fall attire. Yeah, I look forward to sweater weather, and it's finally cooling off in Texas, which is amazing. Okay, thank you all so much. So I think we're actually going to have Dr. Friedman share at the end of the webinar because she's unable to join at this moment, but I know we're all looking forward to hearing from her. So we're going to come back to this at the end. So for now, I'm going to turn it over to my colleague, Lisa Brochard with the National Center on Early Childhood Quality Assurance. And Lisa's going to just talk to you all about North Stars and about fiscal context and all kinds of good stuff. So Lisa?
Wonderful. Thank you, Nina. I appreciate it. And thanks everyone for joining us today. So yes, let's talk about our overview of focus. So let's look at your North Star. So what do you want for all of your childcare programs in your state, right? What are you ultimately shooting for them? Is it a livable wage? Do you want to make sure that they're keeping their classrooms open? Do you want them to add classrooms? You know, all those good things. But what do you want in your state for all of your childcare programs? So if you can just take a few seconds in the chat just to put your idea down for your state. This is your North Star. Childcare programs to be fully staffed and for all children have high quality childcare program to attend. That's awesome. Again, think of your North Star. Think of the ultimate thing that you would want to happen. Any other ideas? What about classrooms? It's a big question, right? And it's probably because there's just so many things that we want for our programs, right? There's so many things that are just interrelated. It's a good deal. So in the back of your mind, I want you to know, if you haven't put it in the chat, I want you to think about what your North Star is for your state. And we're going to talk about how you can potentially get there. So in order to get to your North Star, you need to know what your current context is, right? You need to know what your current fiscal environment is in your state, right? In your state, territory, or tribe. Are there things that you're worried about in your state? Are you worried about the COVID funding that just ended? Do you see any tough decisions, coming down on the horizon? So thinking about your fiscal environment. Use the chat to share something about that environment in your state, territory, or tribe. How is your fiscal environment? Are you in a good place? Are you a little worried? Are you scared to say? So, it may be things that, you're thinking about. You may have to make some tough decisions coming up. There are some states that are having some elections coming up soon that may or may not help out in the whole context of your fiscal environment. So, just learning what your North Star is, and then, learning what your current context is, your current fiscal context, knowing what that is. You need to be able to know that in order to get to your North Star. So how do we get there, right? So many different ways of getting from your North Star, with your fiscal environment, knowing that at hand. So how are you going to get there? Are you going to make incremental changes in your state? Meaning that, are you going to, take it just, a little bit at a time? Are you going to look at prioritization, maybe looking at projects that you have in place right now? Are those projects getting you where you need to be? Do you need to relook at those projects? And if they're not, then maybe repurpose that funding, right? Looking at new financial strategies, tax revenue, things of that nature, or some other ways to get there. So in the chat, if you can, what are some things that you're looking at to get to your North Star? Some things that you're considering. Anything else come to mind?
And I think too, like if you all want to expand on any of these things, like if you are having to prioritize and make tough decisions, feel free to share just a little bit about that in the chat, because we guarantee others will be in the same boat.
Absolutely.
Lisa, I'll share that, in Arizona, when I was thinking about the true north, it's really being able to serve our communities by providing high quality early learning and care in a way that meets their families' needs and that is predictable and sustainable. And fiscally, it's going to be a huge challenge to backfill even a portion of the relief funds. And so from getting here to there, it is about incrementally, communicating the priority without saying that something that may not get funding in this next session isn't important, but really trying to build a prioritization of foundational investments and areas where we really need a larger state investment versus areas where we can maybe be a little more creative or explore other solutions. So it's a little bit of what we're thinking here in Arizona.
No, I think that's brilliant, Leila. I mean, I think it's not a one size fits all, even in your own state, right? So that's what you're realizing. And the incremental part, I think, is huge. Sometimes that's just, easier for the legislature, to deal with rather than, one huge amount that you're asking for, right? So that's incredible, Leila. Thank you. Hannah put in the chat, the district has local financing to support educator compensation, which is part of their vision, their North Star. So that's incredible. So definitely that local support is a way to get to that North Star. Thank you, Leila and Hannah. Okay, so let's look at definitions. Okay, you have probably seen these before, but we're going to go through these again and just to make sure we have the context. So market rate. So market rate is the amount charged by providers. That is most likely what families can afford to pay, right? It's not likely covering all the costs. So it's just what those families are able to pay. Next, looking at cost of childcare. These are the actual expenses the providers incur to operate their programs, right? It may consider, in-kind contributions such as reduced rent. They may consider allocating their expenses across classrooms and enrolled children. So again, it's not based on what parents can afford like the market rate is. And then next, looking at the true cost of care, the absolute true cost of care. So that is the cost of operating a high quality program with staff and materials needed to meet quality standards and provide a developmentally appropriate learning environment for all children. The true cost includes adequate compensation to recruit and retain a professional and stable workforce. So again, this true cost includes that adequate compensation, right, to recruit and retain. So that's important to keep in the back of your mind for that stable workforce. So we know in the back of our minds what our North Star is, right? And we know what our fiscal environment is in our state. Now we need to look at that gap, right? And how do we identify that gap? So where do you see provider level gaps? And within childcare settings. So looking at annual per subsidy infant rate versus actual cost per infant. So the subsidy rate versus the actual cost, definitely a gap there. Looking at revenue at quality improvement system level 4. So just that revenue that you're able to bring in, it might be tuition, it might be subsidy, but then the actual cost of running a QRIS level 4 program is much higher. And then also current cost of family childcare versus the true cost for family childcare. Definitely differences there. And these are, just a few examples of provider level gaps. Do you have any other ideas or any other things that you are facing in your state that are provider level gaps? If you do, if you want to share that in the chat. Okay, good deal. So you've got your provider level gaps. There are many. These are just a few examples of those provider level gaps. So let's look a little bit deeper into this. So looking at the gap between subsidy and cost at a per infant at a provider at a particular provider level. This is just a hypothetical situation. So the average annual per infant subsidy rate is $12,000. Looking at the average annual current cost for care for an infant is $17,000. And then looking at the average annual true cost per care, remember that's the adequate compensation, it jumps up to $21,000. Let's look at, I'm a percentage person, so I like to look at percentages. Looking at the percentages, going from just paying the, at the subsidy rate, going to current cost, that is a 42% rate increase. Going from a current cost to the true cost, that's an additional 24%. So you can see where those jumps can occur. Again, this is just a hypothetical, varies from state to state. So let's look, we talked at a provider level. Let's talk about at a system level or at a state level. They're very similar, right? But just on a grander scale, okay? So looking at current annual subsidy expenditures for infant care versus estimated subsidy expenditures to support the cost of care for infants. So those are, those are things that, at a state level just get to be, at a much bigger level. Okay. So, we all know that infant payment rates and actual cost of care for infants are definitely different. The subsidy and tuition that you can pull in for a level 4 program again versus the cost is definitely different. So we see that at a state level as well. How do you actually estimate where your gap is? Okay, remember you have your North Star, you know where you are fiscally, but you have that gap that you have to figure out. So there's several steps that you can do. The first thing is revisiting your goals, right? Reviewing your system goals and align with your fiscal goals. Again, like I said, your North Star, your fiscal environment, and you know where you need to be. The next thing to look at is projecting the number of children needing funding. Okay, looking at ages, infant toddlers versus pre-K, quality level, the settings, all those make a difference. Okay, looking at you may want to look at birth rates. How many kids are coming into the system or could potentially come into the system, make a difference. Looking at your eligibility criteria. Do you anticipate changing your eligibility criteria in the next few years so that more families are eligible? That's definitely going to change the number of children needing funding, right? So all those play a part in that. Estimating the cost of providing care. Again, looking at ages, looking at quality level, looking at the setting. Consider how you might phase in funding to support wage increases. To Leila's point, sometimes you have to phase those in or do them incrementally. This is all coming up with the cost that it's going to take to get to your North Star to address that gap. A few other things to look at is, asking the legislature for a certain amount of money, but just, a certain amount one year, and then, in addition to that, an additional amount the next year on top of that. There's ways that you can do it to where it is not a number that the legislature just sort of rolls their eyes at, right? So it's doing it in a responsible way to a certain degree. You also may need to adjust your cost every year. I think these are all sort of moving targets to a certain degree, right? And looking at that over a several years and being able to adjust that is very important, because as we all know, inflation changes all the time. There could be some additional statutory changes that could change that number. So just taking that into consideration when you're estimating your cost and knowing that it could be a moving target. It probably will be a moving target. And then compare your current revenue versus your total funding need. So projecting your operating budget by funding source compared to projected expenses. This will tell you where your gap is. Let's look at a visual on this. So projecting the system level gap for infant and toddler care. So looking at the subsidy payment rates for infant care and the projected costs for infant care, you will see a gap. So in the green, you'll see that the subsidy payment rates. You see it does go up gradually through the years, but then when you look at the projected cost for infant and toddler care, it does go up, more dramatically, and that's your gap, right? Where that star is your true cost of infant and toddler care with those recommended salary levels. Again, taking into consideration through these years that this is going to be a moving target. So perhaps, taking a look at these numbers every year and projecting out. You may want to consistently project out at a 5-year period of time. You may want to project out, at administrative changes, things like that. So those are all things that states just do differently. But it's a good way to know what's coming down the line, because I know you'll get questions all the time. How much money? We want to give money. How much money do you need? And you want to give them the right number, right? The worst thing you want is to give them a number and it's still not enough. So just keep that in the back of your mind there. So for right now, I'm going to turn it over to one of my colleagues, Shannon, with the National Subsidy Center, to talk about a wonderful tool, a budget calculator. So Shannon.
Thank you. Thank you, Lisa. Good afternoon, everybody. My name is Sharon Oakes, and I am with the National Center on Subsidy Innovation and Accountability. I am as a subject matter expert in the fiscal area. Previously to joining NICSIA, I was the Chief Operations Officer for the Early Learning Coalition in Manatee County, Florida for 12 years. And prior to that, I had 19 years of various roles of the subsidy programs. As you look at projecting for gaps in care, NICSIA has a budget calculator that could help you determine the impact on the bottom line of your budget by adjusting one or all of the different priorities. It is customizable. It does look at the impact of the eligibility levels, the rates and co-pays on a lead agency's bottom line. And if you're interested, you could request individualized TA for the calculator. So the CCDF budget priorities are, as we stated, eligibility levels. Those refer to the income eligibility levels for families. Rates are the reimbursement rates that you pay to your child care providers, and co-pays are the family's share of the child care subsidy payments. And as you go through the rate setting process, you will want to keep in mind the impact that these areas have on your budget. The push and pull of each area by making changes is constantly changing. A real life example is rates, putting more money into provider rates. How could that impact your family copay? If we raise the provider rates, do we also raise the family's copays in order to minimize the impact on the budget? Or do we adjust the eligibility levels to reduce the number of families that we are serving, possibly creating a waiting list for subsidy services? The budget calculator will help you visualize the impact of these budgetary constraints. This is a high-level recap or overview of what we showed in the previous slides. Different variables that impact the specific areas can be customized to your state or local agency scenario by inputting your current available funding and using the worksheets within the budget calculator to make proposed budgetary changes. This section pulls in totals from each worksheet within the budget calculator. So if you wanted to make reimbursement rate changes, eligibility level changes, co-pay changes, those would all be calculated on individual worksheets using information that is provided to us by the lead agency. And then we would help you make those determinations. As an example, we worked recently with a territory who wanted to know if they raised their reimbursement rates and also increased the number of children that they were serving, would their budget be able to handle it? While going through the entire budget calculator with them, we were able to help them determine that, yes, this was very possible, and they have already started those implementations. So if you need, again, assistance with this type of budget projections, please, our information is at the resource page at the end of the slideshow, and I hope you found this information to be helpful. Thank you.
Good deal. Thank you, Sharon. This is an amazing tool. I think it answers a lot of questions that you know that you're going to get when you're considering these sorts of changes. So just a wonderful, wonderful tool. I encourage you to reach out. Okay, so we are going to talk with Hannah Matthews from Washington, D.C. and Leela Wendell from Arizona. They have graciously agreed to give us some more information from their standpoint. I think it's wonderful to hear the changes that that they saw, the problems that they hit. So so Hannah and Leela, and in no particular order of how you want to answer, but where did you see a pronounced gap between cost and revenue in your state or territory? Who wants to go to first, Leela or Hannah? Hannah, I saw you get off mute.
All right, I can jump in. So we did our most recent cost analysis last winter. So it reflects costs as of the end of 2022, beginning of 2023. We also did a market rate survey at the same time. So we were able to compare rates to the price of care and to the cost of care. So I would say the results are not surprising. With a few exceptions, the projected costs of care were higher than our subsidy rates for nearly all ages and settings, with a few exceptions. They were also, the costs were higher than the median tuition charged to private pay families. So we saw that as well. The biggest gap was in infant toddler care in centers, and particularly our smaller providers, as they have proportionally more staff to be able to cover, which is of course the driver of the costs. Interestingly, our gap for rates in child development homes, we actually at our higher quality levels, the rates paid to child development homes for infants and toddlers exceeded the cost of care, but we found gaps for homes for other age groups and for homes with our lower quality ratings. So again, that's because we have a tier reimbursement rate system. The gaps for programs that are at the lowest levels of our QRIS were the largest.
Gotcha. Hannah, I'm just going to ask a quick question, sort of follow-up question to that. So correct me if I'm wrong, but I think you said that you saw a difference between smaller programs versus larger programs. They're more expensive for smaller programs?
That's right.
Okay. What do you think sort of was that factor behind that, do you think, potentially?
Well, I think it's just the ability to distribute the overall costs across a program. So, we see some differences clearly we were able to do modeling that really reflected the average sizes that we have in the district. So, kind of looked at small, medium, and large based on the number of children that they're serving. And certainly there are some additional costs as you get to the larger programs because they're employing more staff in the front office or things like that. But overall, just the ability to spread the revenue across multiple children is a cost saving. So that was a big difference. I think the other piece that I would add is that our larger facilities are more likely to serve infants, toddlers, preschoolers, and our school age kids, and can serve many more school age kids. And that really is a cost saving to your overall average per child cost, because it certainly is significant. It does cost less to serve those school age kids.
That's where they make up their money, right? Yeah, that makes sense. Leila, how about you? Where did you see a pronounced gap between cost and revenue?
Yeah, so really similar to what Hannah also shared as the gaps in DC. And just for some context setting, so we did our cost of care, cost of quality analysis in 2020, 2021, and our market rate survey in 2022. So we are really looking forward to being able to do them simultaneously within the same time period, but the lessons are still there. The takeaways are still there. Biggest gap for infant care, biggest gap for smaller providers and family child care providers. And so it's certainly telling us a story of, again, ratios, staffing, that it's a big driver. And when we're looking at high quality care, of course, that's a big component of it, as well as building in time for training, professional development, and other things that really create the high quality look. I think, when we're looking at some opportunities too, it's really looking at family child care in how we are assessing the salaries there. So I see a question for Hannah in the chat, but just jumping on that, it's really looking to say for a family child care provider, they're the educator, they're the business owner, they're doing all of these pieces. And so being able to account for the dynamic roles that they have and accurately evaluating salary to cover that. A lesson learned too, kind of a more recent lesson that we'll bring into our next cost analysis, is we used salaries based on the Department of Labor's Bureau of Labor Statistics. So we use certain classifications there. It was brought to my attention that next time around, it would be more valuable to look at more recent data. So there's a big lag in those salaries. And so I think another thing we saw were huge changes, impacted costs because of the pandemic, and now just increased costs because of inflation and other things happening. So we would be looking at data sources that are more like Indeed, or what are providers hiring at today. So I anticipate seeing a gap there as we compare those two reports.
Good deal. Leila, thank you. Like you said, there's a couple of questions in the chat. So Hannah, for homes, did you include salary in the family child?
So we did. When we did the tuition rate assessment, we did a child care provider survey that incorporated additional questions. And so we were collecting information to inform the cost modeling, which is related to our new educator compensation initiative. So we collected salary data. So we were able to use average salary estimates. And, we know that family child care providers don't always consider themselves to be taking a salary, but we did get some data to be able to inform that. We also made adjustments to other staffing positions based on the BLS data. The reason we needed to include a current salary, this is a little bit going to your next question, but just to give the
great, it's great.
We do our cost modeling for CCDF. We also have a local mandate to do cost modeling, and are also supposed to use it for the purposes of assessing the impact of our early childhood educator pay equity fund. And so beginning this year, facilities that opt into our compensation initiative, the pay equity fund, will be required to meet minimum salary requirements for teachers and assistant teachers. So we used our cost modeling to both look at the current cost of care, but also to see what would the true cost of care with those higher salary requirements be. So we did have to use salary data for that reason.
Gotcha. So are you guys paying at true cost of care now, or not quite there yet?
We are not there yet.
Okay.
We are not paying at the current cost of care yet either. We were able to raise our reimbursement rates just effective at the beginning of this month. They do not get all the way to the cost of care. The educator compensation piece is picked up by separate funding. That's where we have the local funds to support wage supplements for early educators. So if we think about layering on the rate increase and the early childhood educator compensation initiative funds, there's certainly more resources to facilities, but likely still doesn't get all the way to the true cost of care.
Gotcha. Another question I asked, and it's not on the list here, but I'm curious, is I think you both said that you both did a market rate survey in addition. And did you find it helpful, not helpful? Did it affect, your rates?
You want to go first?
Okay, yeah, I'll share. And Hannah, I just really appreciate this opportunity because there are so many similarities in our analyses and experience, and also things that I was writing down of like, okay, check in with DC on how this goes. So, oh my gosh, and now I forgot the question, Lisa.
No, you're good. You're good. Trust me. So, so both of you guys used a market rate survey. So
yes.
Mm-hmm.
So I think this is where DC, we might be able to take a few lessons. So I'm curious what Hannah says, but we're really, really interested on provider behavior. So as we increase our CCDF subsidy rates, where are we going to see that cost go? And will some amount of that be savings to the parent? So yes, for our CCDF subsidy, we have control over what they can charge a family, but we know this will impact private pay as well. So we don't know yet. We see these differences of what parents are being charged. We know that there are some fees kind of above and beyond that we're assessing, and how can we make sure that those are covered within our reimbursement rates. But I think it's extremely important for us to just get a handle on and keep a pulse on what is the impact to parents, what is the impact to providers, and how closely, like when are we aligning to that perfect equilibrium?
Gotcha. Good deal. Yeah.
I agree with everything that Layla said. I mean, I think what's interesting is, we strongly believe that doing the cost of care analysis is the best way to really be able to understand the larger sector and think about setting our rates. At the same time, it's really important to know what parents are being charged for childcare, right? So while the market rate survey is not sufficient, it certainly tells a piece of the story. And so I think having all of those together is really important for us. So, I think it was quite interesting to see that some of our rates at the lower quality levels were where they fell across the percentiles of the market rate. And also to see that really when we looked at our cost model analysis, the only providers that were operating above a profit margin were those at or above the 75th percentile. So, we know that providers can't charge the actual cost, but having that in data, I think is really important. And then it helps us to be able, as the question said, I mean, we cannot set our rates at 100% of the cost of care. So when we do those estimations to see, how close we can get, it helps to both have a marker against the cost, but also to know what that looks like compared to what the private pay facilities are getting. And the last point I would make related to that also is that we know that most of our facilities are not serving all subsidy children. So when we do the revenue side of the estimate, it's really helpful to, again, have that updated information on the market to be able to say, okay, if I'm a facility and I'm serving 50% subsidy kids and 50% private pay, what does that look like for my revenue versus 100% versus 20%? So I think all of those pieces together, as much data as you can get, is going to tell a bigger picture.
Yeah, it definitely tells the whole story, right, Hannah? I mean, it really does tell the whole story. Are you all able to pay above what they're charging? If your rates are above what providers are charging, are y'all paying that?
Our rates, the most recent increase, our rates are above the 50th percentile for all age groups. And then again, some are higher based on the quality level rating of the facility.
Gotcha.
And in Arizona, we are really using the cost of care, cost of quality data to inform our rates that are currently set at a market rate level. So we also have a base rate, and then we provide a quality incentive. That quality incentive is 50%. We don't have dynamic technology where we can have varying factors and levels of how to reimburse. So we kind of have okay, what percentage are we going to assign for, this number of providers? And we can't, have a ton of options. So we landed with the 50%. That was really good. So what we ended up seeing is though some of our base rates may not be at the 50th percentile of the market rate survey, with the enhanced rate for those providers serving children in high quality settings, we're pretty close. We're at like the 99th percentile or 97th percentile. So I think it's going to be a challenge for us to work through how do we align the base rates to equal the cost of base care, and then again, incentivize the quality through matching that. So for now, we have been able to have the funding to test this out, to know that we're reimbursing high quality providers at the cost of providing high quality care. And what we've seen is an increase in the percentage of high quality childcare providers that are contracted to serve CCDF families. So we know it's working there, and have really identified this as a foundational priority for us to continue to support.
That's wonderful. That gives me chills. That's incredible. Absolutely incredible.
Can I add something on the
Absolutely, Hannah.
piece there? So we have tiered reimbursement rates at 4 different quality levels. And when we did the cost model analysis this round, we actually re-looked at some of the inputs into the cost model related to quality levels, and really determined that, and our QRIS is all based on classroom observation. So I think you could certainly make the case that there are some costs that could differ between higher and lower quality facilities, but overall, there were not really cost drivers that were related to those observations. And so when we looked at the cost model and had to say that these facilities across all quality levels have the same costs, it really moved us to want to put an emphasis on raising our rates for facilities that were in the lower quality levels. And so while we still have 4 levels of the quality ratings, we moved to have only 3 tiers of reimbursement rates. And so what we did was we combined the lowest 2 and brought them both up and moved them closer in percentage wise to our quality and our high quality levels. So that was a conscious choice that all providers received an increase in rates, but the providers at the lower levels got an even higher boost to really be able to give them the resources to support the same costs that they incur.
Yeah. Hannah, and it may be too early to tell, but are you seeing an improvement in their quality?
That's too early to tell.
Too early to tell.
Yeah, we just raised the rates.
Yeah. I'm just
1st,
excited.
so.
I want to. Yeah, that's wonderful. Wonderful. Good deal. Good deal. Well, so I mean, you may have answered this question already, but did you use the current cost or the true cost as your goalpost?
Well, I'll jump in to say that we're really learning more about identifying a true cost. So even though we did the cost of care, cost of quality study, like I mentioned, reassessing the inputs in the analysis. So are they really getting us the current information, and are they getting us to our goal, our true north, where we want to go? So we thought we're in that realm of saying we know it costs this much based off our assumptions. This is the true cost of care, and that's what we're really using to get there. And then strategically, how are we aligning the rest of the system? So again, like Hannah mentioned, and this is just so great, it's really helping us say we need to come back as system partners and evaluate what our quality framework is. So, where we're really identifying where we see those differences between kind of medium and high quality care, like where is that? What are the supports needed? What is the cost needed to support that? So I think we are still exploring the true cost of care, but we've fundamentally shifted from price of care to cost, and are really exploring how we continue to communicate and evolve that analysis.
Wonderful. Hannah, anything to add?
I think it's similar. We certainly have kind of both the current costs that we can compare our subsidy rates to. As I mentioned, we have the analysis with the higher salaries to really be able to think about true cost. We also have, again, kind of played around with some of the design of the cost modeling tool to be able to allow for more scenarios. So one option, for example, is to be able to look at a facility that is a higher quality program and would employ other staffing positions, such as, maybe a mental health consultation or, thinking about the kind of wraparound and comprehensive services that you would really want if you were thinking about what a real North Star is in terms of a quality facility. So we have some ways of now being able to look at those costs as well, so that it really gives us, I think, a broader range to think about where kind of how all of those resources are aligned to bring together for a program.
Great, great. And I think we just have maybe 2 or 3 minutes left to try and answer this last question. But can you describe the process of comparing your current budget to system level costs? And I know that can be pretty deep, but maybe at a high level, if you can talk through that process.
Sure, I can start. I mean, I think it's maybe an art and not a science. It just takes a lot of patience and multiple iterations. So, like any state, we do not have the resources to pay at the true cost of care. We don't have the resources to pay at the 100% of the current cost of care. So, what do? We, run a lot of different scenarios. And in the district, we are still we are expanding access as well as raising rates. Our subsidy enrollment is still pre-COVID levels. So we are doing some things and just increased income eligibility to be able to expand subsidy. So for us, it was, I like the triangle visual that you put up before, but it really is kind of, okay, if we raise income eligibility by this much and raise rates by this much, and think about projecting out increased enrollment over years, how far can we get? And so, it's a little bit of trial and error. I think the other piece that I would go back to is I think it's really important to be doing that analysis in the context of key priorities. So maybe that goes back to the North Star conversation. In the district, for example, we have a large share of 3- and 4-year-olds served in our public pre-K. So it is a, important policy priority to expand access to affordable infant toddler care. So it was very intentional. When we raised rates for infants and toddlers at a much higher percentage than we did the preschool rate, because we want to incentivize that care for facilities. So, I think you can do, it's probably an infinite number of scenarios to model within, whatever the calculator you're using. So being driven by where, what the incoming assumptions are around your priorities and goals is really important.
That North Star, right?
Yeah.
Yep. Perfect. Leila?
Yeah, it really is a balance between an art and a science. And a visual that really helped me think about communicating where we are in Arizona is what Sharon presented, the triangle. And I'm thinking, okay, how do we grow the triangle, or does it become an octagon, right? Like different things of being able to show right now in our system, it's looking at funding the foundation through our rate setting, but being able to still show that there are other key priorities that are important that we would then build from. So I think that's really the biggest part. And as Hannah mentioned, we're still keeping a close eye on our caseloads. So we're not quite at pre-pandemic levels. And even then we had only about 20 to 25% of children eligible actually authorized for care. So we're still in that scenario. I think beforehand it was that even with our subsidy, families couldn't afford care. Now that we've increased the subsidy and families could afford the care, there are wait lists. We have 50% of our providers reporting that there are wait lists in their infant, toddler, 3- and 4-year-old classrooms. So now it's kind of shifting. And when we're looking at our projections, it's like a new triangle, right? Of, okay, well, what are we doing to increase the capacity? Because we know when we increase the capacity, the cost of reimbursements that we pay out is going to go up. Right. And we're doing some IT initiatives to ease the application process, putting it in plain language, making it mobile friendly. So we know access to even apply for services is going to change. So we keep that in the back of our mind, as well as, some of our stakeholders talking about increasing the overall eligibility. So that's the other piece that I think it's just important for us to communicate that there are several things working at the same time, and that we will take what is supported and make it work and be able to then communicate where the gaps still are.
Great, great, great answers, you guys. Yeah, it can definitely be a moving target, and to explain that sometimes is a little difficult, but it is definitely a moving target. Thank you so much. I really appreciate it. And we had a few questions come in, and I think you guys have answered that, so that's wonderful. So Hannah and Lily, if y'all can hang on, I think we may have some more questions for you a little bit later on in the presentation. So hang on. Good deal. So I think next we are going to do an internal poll. Again, this won't be published publicly, but this is for us to know. So how much has your understanding of identifying program and system level gaps improved? Not improved, a little improved, moderately improved, or significantly improved? Give me just a few more seconds. Okay, Tatiana, we good?
Yes.
Okay, good deal. Thanks everyone for participating in that. Really appreciate it. So let's go looking at exploring funding mechanism and financial strategies. You know, I think, Leila and Hannah talked a little bit about this too, but we have to pay for it one way or the other, right? So how do we do this? So funding mechanisms in order to get, money to the providers. How do you do that? Again, rates is definitely one. Grants is a possibility as well. Bonuses and stipends are another. But in your states, if you can in your chat, what sort of mechanisms are you using in order to get funding to providers? Anyone want to volunteer 1 or 2 items into the chat? If not, Hannah and Leila, do you have any suggestions on how you guys did it?
Well, I think I mentioned we have a separate source of funding for our early educator compensation initiative. And so that is a tax that is exists in the district, and a fund in which the money goes into that is reserved for raising the salaries of teachers and assistant teachers in our child development facilities. So that's a huge piece of kind of the puzzle for us. And the district is also very fortunate to have significant local funding for subsidy in addition to the CCDF funds.
Wonderful, wonderful. Thank you, Hannah. Leila?
Yeah, so because of a lot of the relief funds, we were able to really, as all states and territories, implement a grants program. And so we had one that covered base operations, and then we did another one specific to incentivizing the workforce. So whether that was a bonus or an increase to the overall salaries, stipends, we had that. And so it really is right now with the funding coming to an end, just a matter of balancing rates and how much it would cost to maintain rates to the levels we've been able to increase them, and acknowledging that there is still a need to finance and support the private pay families. And that's an area where we're looking at strong partnerships with the business community in Arizona. The CHIPS Act has a huge potential for us. So how are we leveraging the partnerships there with big industry, though it's serving families that would not be eligible for our CCDF subsidy? How do we make sure it doesn't take away supply? And how are we building dynamic partnerships to have other mechanisms to fund childcare for all parents?
That's wonderful, Leila. Thank you, Hannah and Leila. Appreciate that. So let's also look at financing strategies. And I think Leila and Hannah, you kind of spoke to that, right? So ways to get money to the state itself so that it can be passed down, right? So it could be tax measures, public-private partnerships, TANF money, opioid or tobacco settlement funds, lottery dollars. All those are different ways of doing it. As far as tax, measures, it could be, millage tax or tax abatement. Could be an alternative there, but there are many ways. This is by no means the only way to do it. Some states are very, very creative in ways to do this. So I think sort of the sky's the limit on how you can potentially do this. And, probably in most places it takes more than one, right? Multiple ways of financing this. Hannah, Leila, anything to add to this? Or anyone on the chat in the audience?
Well, I'll share that we have identified in Arizona that there are portions of other federal funding sources that are flexible enough to cover childcare. So even working with our workforce teams, there's a whole component of being able to either job train or interview and apply for jobs that childcare would be needed. So that's in the back of our minds as a strategy to explore. In Arizona, most of our TANF funds go to our child welfare system. So as a first step, we are looking at shifting some of the TANF funds to really be more prevention efforts to prevent families from even coming into the child welfare system in the first place. And a big portion of that is childcare. We know the vast majority of child abuse and neglect specifically, could be mitigated by the availability of high quality care and supervision. And so we're at the table to really say, how do we evaluate and support those needs for families before they get to that crisis point. And I do think the state and our stakeholders will really be looking at other methods to support a lot of the progress we've made over the last couple of years. Mm-hmm. We have a very small general fund investment, specifically in child care subsidies. We have some other funds, voter protected through our Birth to 5 agency. But as we start looking at all of the work we've done with the relief funds, we have to start thinking about the dollars in a whole system perspective and how we're appropriately assigning kind of primary role, secondary role, and also that will help us, I think, really be able to share where the needs exist and how the system fits together as a whole.
Yeah, I think like Leila, and feel free to disagree with it, but really taking a critical look at the programs that exist now and deciding if that's still the right way to use it or moving it. And sometimes it's not an easy decision to make, but it's the right decision to make, right? So yeah, absolutely. There's a question in the chat for both Leila and Hannah. Have you evaluated the successes of different funding mechanisms and financial strategies? And if so, how?
So we are working with our early literacy partners here, Read On Arizona, and they have subcontracted with the Children's Funding Project. So we have done some fiscal mapping that does look at a variety of federal funding sources as well as state level funding. So it's really helping us, I think, even as a communication tool to understand what's already out there and how much are these either funding a program completely or partially. And again, I think it's going to be helpful for us to not only educate others, but come to the table and start thinking of different ways to structure the system and specifically the financing of it.
Perfect. Good deal. Good deal. Okay, so Heather, anything else to add to that? Otherwise, we're going to jump to more questions for you because you guys are just amazing.
So the other thing that I'll add that is not about financing at the state level, but thinking about how it flows down to the providers is we are funding partners through grants to do quite a bit of work on shared services with facilities, with both homes and centers. So I do think it's both kind of thinking about the big picture financing at the state level, but then also what does that look like at the individual program level, and how are providers putting together the different revenue sources and thinking about their own business model? So that piece seems like a really important piece as well, a little bit different.
That's an extremely important piece. Yeah, and it's a little bit of a learning curve, but that's wonderful. Good deal. So a few more questions for you guys. Have you thought about prioritizing rate increases or other supports, and how might your plans evolve over time? So I think you've talked a little bit about that, but if you want to expand a little bit on that.
Yeah, I really do think it's understanding that true north as we've been talking about it, and being able to incrementally put together a plan that fits the momentum of the moment. So for us right now in Arizona, it's really expressing how meaningful it's been to increase the base rates and to have that 50% quality reimbursement rate. And we have data to show how that's increased our network of high quality providers for CCDF families. And so that's really our priority at the time. And it's also an opportunity to share what isn't funded to move forward. And so again, like, where are there roles for our other agencies or philanthropy or other partners, private partnerships? Where does that come into roles where they may find themselves able to support? And then being able to, again, show the data and put that forward as a future plan.
Mm-hmm. Good deal. Hannah, anything to add to that?
Well, I think I talked about, how we think about the rate increases and also expanding access and enrollment. I think, we are in the fortunate position right now that we are not yet facing a fiscal cliff in terms of the CCDF funding. We, have funds to spend the ARPA discretionary funding in the coming year. We've had significant local support. So we really are, have been able to think about how to make efforts on multiple tracks, and then have to do the big picture system analysis to see what that looks like in the future, and how long we can sustain some of the growth in the program. So I'm sure the plans will evolve over time as we figure that out.
Right. Absolutely. And I'm gonna check the chat as well, but and I think you talked some about this too, but is your funding for childcare limited to CCDF funds, or do you have other funding sources? So it sounds like you have a multitude of funding sources. Would you mind just kind of relisting those for us and telling us, all the parts and pieces that you're using to fund this? And were some harder to get than others?
So we've been very fortunate to have support in the district for early childhood. So that includes local revenue towards the subsidy program, as well as the Early Childhood Educator Pay Equity Fund. We do have some TANF funding as well that supports the program. So and then several have been fortunate to have both COVID recovery funds, some of the general funds that were not designated for childcare, to also be put into childcare. So have been able to do some more with those funds, and also have some local funding that's specifically tied around the priority around expanding access to infant toddler care. So we've been able to give grants to facilities to make improvements, to convert classrooms, to expand or create new infant toddler spaces.
Great.
And in Arizona, the funding has been pretty limited. So our CCDF funds cover the majority of care, and definitely for childcare subsidies. For context, we serve about 29,000 children, CCDF subsidized children. We have, I think, about a $9 million general fund investment that matches childcare specific to families involved in the child welfare system. Mm-hmm. Of the $1.3 billion of federal relief funds, we estimate about $100 million needing to be added to continue the maintenance of rates. So that's in addition to about the 250 million of regular CCDF funds that we have. So in Arizona, it's really being able to show that picture. There are levels of what the impact might look like, and being able to share at the base level what is needed to maintain some significant improvements. And then, of course, saying that the story doesn't end there, but let's talk about that over a little more time. Just recognizing that most states are in situations where the funding isn't so readily available.
Gotcha. Great. Any questions from the audience for Leela and Hannah? It's been an amazing conversation. Wonderful. Leela and Hannah, thank you so much. Such a wealth of information and sharing it out. We really, really appreciate it. Good deal. Okay, well, I think we are going to I think it's one last poll. Again, we're not going to share this out. This is for us to know. How likely will you use at least one of these strategies or practice? Will you not use it at all? Probably not. Will consider, or definitely. Give just a few more seconds. Tatiana, if you can just tell me when everything slows down.
We have about half.
Okay. And we'll just give another couple of seconds. Okay, Tatiana, we're good.
Yes, Lisa, we're all good.
Perfect. Thanks, everyone. Okay, again, Leela and Hannah, thank you so much. I'm going to turn it back over to Nina for our conclusion.
Thank you so much, Lisa. And actually, I'm really excited now. We get to hear from Dr. Ruth Friedman, Director of the Office of Child Care. And so we can, Ruth, I see that you're on. And so I will just turn it over to you. I know you had a few remarks to share, and then we'll open it up for questions.
Thanks, Nina. Hi, everyone. I apologize. I was intending to join you at the beginning of this meeting, but I was on work travel last week, which has made my Monday all topsy-turvy. I want to thank our presenters today and Lisa for moderating, but mainly for all of you joining us. I know it is an uncertain time in childcare. There is anxiety among our grantees, as well as certainly providers, when I talk to them about the end of the stabilization funds. And I know that looms large for state administrators. We really are here to support you in any way we can as you work to administer your program. OCC is going to continue to prioritize cost-based methodologies. And so we are doing that. That of course is just, it's a flexibility. It's not a requirement of the law, which I know everyone on this call knows, but I do want to make clear we are coming at it from that standpoint. But it is our goal with webinars like this one, and more things we have in the works to really find ways to support you all as you are thinking about how to set payment rates and ways in which cost-based methodologies might make sense in your own states. I know both budgets and political realities both can create certain challenges in moving forward with these sorts of policies, but we really do think this can be a powerful tool for stabilizing the childcare sector and really ensuring that families have choice if they participate in the CCDF system. So we really do want to continue to hear from you as well. Please let us know how we can support you, what kind of TA would be helpful as we navigate the end of stabilization funding together. And thank you again for all the work that you guys do every day on behalf of kids and families.
Thank you so much, Ruth. I appreciate that. And are there any questions for Ruth from any of the participants? Well, I think we will probably move on to the conclusion of the webinar, but Ruth, if you're able to stay on for a few minutes, just in case any other questions pop in the chat box, I think that would be great. And I know we all really appreciate you taking the time to join and share the remarks from OCC, and just recognizing that we're asking folks to prioritize focusing on cost, and knowing that the COVID supplemental funds have ended, and so that folks are needing to prioritize and make decisions, and just want to recognize that. Okay. So I'm going to share some key points from the session, and I hope that you all too can put in your takeaways. The first is just that cost data can inform planning and budgeting. I mean, really simple. We talked about that quite a bit. The second is that by establishing a fiscal goal, projecting your budget, and projecting the cost of quality care over time, you can have a roadmap that will help you prioritize funding decisions. So basically, it's a good, really, really good idea to have a plan in place so that when the money does come in, you're ready and you know exactly where it needs to go, how much you need, how you're going to spend it, and what you think you're going to need over the next several years. And to stay on top of that, as Lisa said, things will change, and it's a good thing to revisit regularly. And then also there are many funding mechanisms and fiscal strategies to explore. So Lisa gave an overview of a few. Leela and Hannah talked about what they're using in their jurisdictions, and I'm hoping that you all can think about what would work in your own. So we are looking forward to the next session of the series. The next one will be in November 7th at 3 p.m. Eastern, and it's focused on engaging providers and partners. So there's a lot to share there. And I'm seeing that Heather shared in the chat a takeaway is Hannah's comment that this is more of an art than a science, and definitely a balance of the two. Absolutely true. I think that's an excellent point. We also just want to remind you that TA is available. So TA on this topic is individualized for your needs. Some examples of that TA could be connecting with resources or with other states. It could be we could facilitate discussions about planning and prioritizing. We can help you think through your funding or financing strategies, help you think through your payment rates, your rate structures, and your payment policies. And in case your interest was piqued when Sharon showed you the budget calculator, that's also something that Nixia can help you with. So it's a great resource, and there's a QR code on the screen if you want to scan it with your phones, and a website there as well. So we hope you can reach out if you need any support. And then lastly, we just want to highlight some resources. So as we've been saying, this call is one in a series of calls focused on alternative methodologies, cost-based alternative methodologies, and cost modeling and decision-making. The rest of them are available on the CC10 website, so we hope you can access those. We have recordings of all of them and slides to go with them. Here's a great resource on budgeting, on funding and financing, and then a good resource on planning. And as I said, these slides will be available on CC10 too, so you can access them. And then we just want to leave you with a question. So we'd like to know if there are any other webinar topics that would be useful to you. So you can go ahead and take your time responding. And we just want to thank you all for your participation and your engagement. And Leela and Hannah, we are so appreciative of your time on the webinar today. I love listening to both of you and learned so much. So we're very grateful. And hopefully you can come and visit us again on one of these webinars. So thank you, everybody. I hope you enjoy your fall. Drink some pumpkin lattes or pumpkin spice or whatever it is that you like about fall. Enjoy your sweaters, and we'll see you next time.